estimated globally that over 422 million people have diabetes, and every year 1.5 million deaths are directly linked to this insulin-related disease. Here in South Africa, it's estimated as many as 5 million people have diabetes. Well, today is World Diabetes Day, and I'm joined now by Senior Specialist Physician at the University of Pretoria, Professor Paul Rheeder. He's also Director of the Diabetes Research Centre there. Good evening, Prof. So talk to me about the stats we have in South Africa regarding diabetes, and is it continuing to rise?
Thank you. Yes, so the statistics in South Africa, it's estimated that about 11% of South Africans probably have diabetes. So that is of great concern. Also important in the statistics is that when you do surveys, it's often found that about half of people who actually have diabetes are unaware of the diagnosis. So that's another important statistic to remember. It's also important to note that certain groups have got a higher incidence. So when you talk about how common is diabetes in South Africa, it all depends on which people group you are actually talking about. So the older population group will have a higher incidence than just the 11%. And then we do know that certain population groups, like the Indian population, for example, in South Africa, have a higher incidence. So yes, it is quite concerning. And globally, as well as in South Africa, yes, the numbers are increasing. So, we probably see a doubling of the numbers over the next 10 years. So this is of great concern.
Is the growth in numbers purely related to the lifestyle version of diabetes, which is type 2, rather than the one that tends to be hereditary, which is type 1?
Yes, I don't think we have any data indicating in South Africa that type 1 as such is increasing. But similar to the rest of the world, type 2 diabetes is closely linked to the obesity epidemic. So as the figures of obesity are continuing to rise globally, also in South Africa, so will type 2 diabetes rise. And yes, this is linked to lifestyle. This is linked to nutrition and dietary habits. And so, yeah, this is what we will be seeing in the future.
Is metabolic syndrome often a precursor to diabetes?
Yes, I think that's a good question, because I do think it's important to recognize that, there is this condition called pre-diabetes, if you want. So, when people are overweight or obese, they often have high blood pressure, they may have gout, they already may have something like heart disease or hypertension. Those people are particularly prone to diabetes, and it's in that group of people where lifestyle interventions and weight loss, for example, can make a big difference. So I think it's important from a public health global perspective to recognize this condition of the metabolic syndrome, which is sort of a collection of things hanging together: obesity, gout, hypertension, ischemic heart disease, etc. So if you recognize that, then you are at risk, and then it's very important to get yourself tested to make sure that you don't have diabetes.
And do we have stats for pre-diabetes or metabolic syndrome? Because I suppose that is like telling us the future diabetic sufferers if nothing's done.
Yeah, I can't quote that offhand, but you can imagine that that is a much higher figure. That's probably at least double the number of people we have with diabetes. So, it also depends a little bit. So the testing of the condition for pre-diabetes is not so simple. There are various ways to do that. But as I've said, I think you can imagine that it's probably at least double that we're seeing of diabetes. So it is fairly common. We know that about 7 out of 10 women in South Africa are either overweight or obese, and probably 4 out of 10 men in South Africa are either overweight or obese. So it's an incredibly common condition and also increasing.
Telling people to avoid high sugar foods and unprocessed carbs is one thing, but doing it is entirely another. What is effective in actually preventing the harmful lifestyle choices that we all tend to make?
Yeah, so I suppose that's the holy grail in diabetes. Everybody talks about lifestyle. Everybody talks about lifestyle education, talking about healthy nutrition and exercise. However, implementing that on a large scale and on a sufficient scale to actually have an impact is proved to be quite a challenge. So when we do research studies under very controlled circumstances, we can manage to do this, and we actually can reduce or prevent diabetes. Without that sort of strict study environment, it's often very, very difficult. But I do think that it's an important message that you can actually reverse diabetes, you can actually prevent diabetes. And I think it's important to take note that, simple choices regarding your nutrition habits, the food that you buy, the food that you eat, the amount of exercise that you get can make a difference. I think it's important, however, that we should realize that it's a very complex situation. It's not just a matter of sort of changing your mind. Often it's a complex social construct, and I think it's very useful for families, for example, to ask themselves as a family, how can we live healthier? I think for individuals, it's very difficult. But families can maybe team together and say, listen, let's live healthier. What are some of the choices we can make? So I think, but yeah, to give an easy, simple answer, it's not going to be possible. I think, it's very difficult, as you highlighted.
Yeah. What is your view on these diabetes drugs, which are also used for overweight people, such as Ozempic and Saxenda, these injectables that really do seem to work to control the appetite? People do report success, so much so that there are often stockouts of them. Do you think they're a game changer?
Yes, I absolutely do think that, they have changed the way that we treat diabetes, and they've increased, the options that we have in the number of interventions that we can use to treat either obesity or diabetes. So I do think they are enormously effective, and under the right circumstances and for the right indication, they will most certainly make a huge difference. But however, I think on a global or public health scale, one must remember, if you're talking about 4 million people with diabetes, going this route is just not going to be a strategy that one can follow. So these drugs will be available, as are many newer drugs coming onto the market now, where they are adding other components to the Ozempic, for example, that are even more potent. However, they are so costly that even countries like the US, Denmark, Sweden, the Netherlands, etc., can't afford to roll out these drugs for everybody. So highly potent drugs, very useful, have changed the way we look and treat diabetes, but on a public health scale will just not be an option. So we have to look at other options for curbing this obesity epidemic. I don't think drugs is going to be the solution.
You're head of the Diabetes Research Centre at the University of Pretoria. You look at prevention and care. What is the latest research telling you? What is the most exciting sort of research coming out? Is there something quite specific that you're revealing or learning?
Yes, I think, like I say, if you look at the bigger picture, you look at the international scene, I mean, the research at the moment is all about drug combinations and the difference that they can make to people living with diabetes. Locally, I think our challenges are far more on the ground. So we have a primary healthcare, public healthcare system that, is actually really remarkable if you compare us with, for example, the rest of Africa. We have a healthcare structure, we have healthcare clinics, we have clinics available in most communities. They have access to the very same drugs that the hospitals have access to. So we actually have access to care. We have clinics that are functional. So that's the good news. I think the bad news is that to effectively manage people with diabetes, especially after the initial stages of the disease, is a complex disease. And for example, transitioning people onto insulin, which has been our main focus over the last couple of years, is a major challenge. So we have found that scaling up treatment, to more than one drug, scaling up treatment to include insulin is a major challenge, and that there are numerous, issues involved in actually changing that situation in the public sector, but also I would imagine in the primary care sector. So the focus should be on increasing sort of the healthcare workforce's knowledge and skills in managing these patients. So our research is focused on the challenges and ways to overcome those challenges. For example, telehealth is post-COVID proven to be a very useful tool. So you could use telehealth to follow up these patients and to monitor their sugar, to increase, to change their insulin dose, etc. So that's one of the things, for example, that's quite exciting and opens up a whole new avenue of treatment for people with diabetes.
And it's so important that we stay focused on this. Thank you so much for chatting to us this evening. Senior Specialist Physician at the University of Pretoria, Professor Paul Rheeder. He's telling us that 11% of South Africans are believed to be diabetic, but double that number. So that's another sort of 8-9 million people are believed to be pre-diabetic. And that's the point at which you can make a change. Of course, we know it's not easy, but it's something we do certainly need to focus on.